assessment of motor performance in hemiplegia, especially in patient hypertone. It is unpopular to use manual muscle test cause tone of muscle, tongue to limb link control, and abnormal reflex can affect the result assessment. So we use quality of movement in upper motor neuron lesion. Patients have to active by themselves and do it like a functional task. The result will be more accurate.
To record the result, physical therapists have to observe quality of movement of patient, such as they can move full arm or not, they have stealthy movement or they have compensated movement. However, we can use this criteria to assess them. Loss, patient cannot control movement. Poor, patient can control some movement. Fair, patient can well control movement but not full arm. Good, patient can control movement like normal.
Scapular protraction. Starting position is supine lying. Physical therapists have to raise patient arm perpendicular to the body. Ask patient to hold their hand for a while and try to reach hand to the ceiling.
Okay, first step. Holding your arm for a second. Okay, good. And then you reaching your arm to the ceiling like this. You should scapular protections upward. Okay. Do you understand? Next step, do you by yourself? Okay. 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 Good.
Holding and placing in flexion and extension. Starting position is supine lying. Physical therapists have to move patient's shoulder in flexion 90 degrees, then flex elbow and place patient's hand on contralateral shoulder.
Okay, the first step, holding your elbow these positions for a while. Okay, good. And then you move your elbow upward and downward like this. Okay, do you by yourself? Upward, slowly, slowly, and downward, slowly, 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 upward, and downward, slowly, slowly, slowly. Okay, good.
Holding and placing in abduction and adduction. Starting position is supine lying. Physical therapists have to move patient's shoulder in flexion 90 degrees and then placing patient's hand on forehead.
Okay, holding your arm these positions for a while. Okay, good. And then moving your arm move inward and outward like this. Do you understand? Okay, next step, do you by yourself. Let's start. Move inward. Slowly. Okay, good. Move outward. Slowly. Move inward. Slowly, good. And move outward.
Eccentric and concentric control of tricep. Starting position is supine lying. Physical therapists have to move patient's shoulder in flexion 90 degrees, then placing patient's hand on forehead. Ask them to hold in this position for a while and encourage them to extend their elbow. If patient cannot move forward by themselves, physical therapists can help them by support their wrist.
Okay, holding your arm these positions for a while. Okay, good. And then extend and flex your elbow like this. Extend and flex your elbow like this. Do you understand? Okay. Do you by yourself? Extend your elbow slowly, slowly. I will support you. Flex. Slow, slow, slow. Extend. Slow, slow. And flex. Okay, good.
Shoulder flex with elbow extend. Patients have to flex their shoulder with elbow extend as full as they can.
Flex your shoulder like this, possible as you can, okay? Flex your shoulder like this. Do you understand? Okay, good. Do by yourself. Slow, 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 slow. Okay, good. Again. Flex your shoulder slow, slow, slow.
Hand function. Examination of hand function should be in sitting position. Patient's arm is on the table or PT held holding proximal extremity.
Okay, first I have a cylindrical object. Then you grab and release this object like this. Okay. Do it yourself. Okay, good. Okay. Next, I put the bottle on the table, lying on the table. Next, you grab the bottle and extend your wrist up like this. Are you okay? Okay. Do it. Okay. Okay, good. Okay, you can grab the bottle. Next step, you have to lift it and by your wrist like this. Are you okay? Okay, do it. Okay, good. Okay, next, you grab this bottle and you supinate your wrist like this. Are you okay? Okay. Okay, good. Okay, the last one. This is combined movement. Can you show me how to drinking water? Okay. Okay, good.
Hip extensor. Starting position is hook lying. Physical therapists have to support patients' hip and then ask them to lift their hip off but back still on the bed.
Okay, starting position is hook lying. Take your knee. Can you hold your knee?
Yes.
Okay, then I give you lift your hip on the bed like this. Okay, but your back on the bed. I give you do by yourself. Okay, start. Again. Good.
Next, we will assess hip extensor of affected side. Physical therapists have to cross south side leg of the patient on the affected leg and then ask patient to lift their hip off the bed.
Cross your legs on the affected side. Then compress your leg or lift hip up like this. Can you try? Okay, start.
Assessment of hip extensor in a range. PT move patient's affected leg beside the bed. Flex knee 90 degrees. Foot flat on the chair or step. Command them to bear weight on the foot and try to lift hip up.
Bear your weight on your foot like this. And then you extend it. Okay, extend it. Okay. Again.
Knee control by quadriceps inner range. PT hold patient's leg to slightly flex knee. Ask patient to slowly extend knee full range of motion. Patient may let knee falling following gravity, so PT have to tell them that do not extend knee over range.
Can you slowly extend knee? Okay. And then flex your knee slowly. Okay. Again, extend again. Okay. Flex again. Okay.
Next, we will assess essential components in lower extremities in swing phase. Starting position is side lying. PT hold patient leg in slightly extend hip position. Ask patient to flex knee, and next slowly flex hip and extend knee. Finally, ask them to dorsiflex their ankle.
Starting position is side lying. I will hold your leg, don't be scared. At first, I will extend your hip and flex your knee. And then flex your hip and extend your knee. And ankle dorsiflexion. Okay, do you remember?
Yes.
Okay, good. Next, do by yourself. Okay, first, extend your hip, flex your knee. And flex your hip, extend your knee, and ankle dorsiflexion. Okay, good.
Pelvic forward rotation. Starting position is hook lying. PT brings patient's south side leg cross to the opposite side, and then ask patient to slowly move pelvic in.
At first, I will cross your affected leg to the opposite side. Okay, don't be scared. And then I will give you hold for a while. Okay, good. And then I will move your knee in and out. Move in and out. Slowly, do you understand? Okay, do by yourself. Move in slowly and move out. Move in and out. Okay, good.
Ankle dorsiflexion. Starting position is supine lying. Physical therapist may put a pillow under the patient's knee and then ask patient to ankle dorsiflexion.
Okay, I will give you ankle dorsiflexion like this. Okay, please do by yourself. Okay, good.
Okay, now you all know about how to assess quality of movement. You can use this assessment in patients with stroke. And today, we all done our work. Thank you for attention. Bye-bye.